Welcome to FAQ, where your patient questions are answered by leading experts in medicine and wellness. And now, here's your host, Hailey Hough.
Hi, I'm Hailey Hough, and welcome to FAQ. Today our question comes from Larry, a patient in Portland, Oregon. Larry asks, I recently had a colonoscopy and I was so impressed with the staff and how smoothly the entire experience was for me. What happens behind the scenes in a typical ambulatory surgical center to ensure that patients have an easy experience? To answer your question, Larry, we turn to our guest expert, Amiee Mingus. Amiee Mingus is a registered nurse and has been in the healthcare field for 30 plus years. Prior to graduating from the University of Alaska Anchorage with her nursing degree, she worked as a manager in a family practice clinic. After several years as a hospital nurse, Amiee transitioned to an ambulatory surgical center. She is currently the Vice President of Clinical Operations for PEGI Solutions in Jamison, Pennsylvania. Welcome, Amiee.
Thank you.
So please, tell us about all the things that happen behind the scenes to make a patient comfortable on the day they have a colonoscopy.
Well, there are lots of pieces and parts that have to, move smoothly to have a patient come in, be registered, and go through their procedure, and then for discharge. But primarily the reason why things run so smoothly is because our staff is highly educated. We have at least annual competencies, and every time we add a new procedure or a new piece of equipment, we spend time making sure that our staff is up to par and able to seamlessly run things behind the scenes while the patient is sleeping. I think in addition to our staff being highly trained, we're aware of the patient's experience with us. At PEGI Solutions, we are primarily about GI, and we understand that a colonoscopy can make people nervous or apprehensive. And so one of the things we do to make things run smoothly for them and to help them feel more comfortable is explaining things along the way. We let them know what to expect and what they can anticipate coming next. And we know the impact of your visit in our facility can impact a lot of others. Your positive experience and the stories you tell about that might help persuade some of your family and friends who are a bit apprehensive. And our main goal is to prevent colon cancer, and we can do that one patient at a time.
Right, definitely. So I know that there might be a general sort of steps that you go through when a patient gets to the office and whatnot. But is there a certain step along that line that you would say should be emphasized the most between, everybody that is working on that team at the time? Like, what is one step that you think would probably enhance the client's experience as it did Larry's?
I think it's not necessarily a step, not necessarily the registration process or the process of getting admitted and going through your procedure. It's the fact that you're going to be treated like a human being, like a person, and not like a case or a procedure. I think the fact that the staff understands what you're going through and does everything that they can to set your mind at ease is the most important thing that we do on a daily basis to help people feel more comfortable.
Awesome. Yeah, definitely. And then I was kind of curious, what made you transition from being a registered nurse to the position that you are in today? What was a motivating push for you to make that transition? Why did you?
I realized I could have a larger impact on more patients if I led a team that understood those things as well as I do, that we treat people, not conditions. And I am still clinical. I run a clinical team, so I am still heavily involved in that. But mainly it was because I could have a larger impact.
Definitely. And then, I guess lastly, has there ever been an instance where maybe you had an upset client or something didn't go as planned, or it was a little more complicated to orchestrate the whole colonoscopy process. And how did you seem to overcome? You don't have to get into details, obviously, but have you ever, ran into an instance where you had to think on your feet and your team quickly, gathered it, everybody got together and worked through it?
Absolutely. We have had those kinds of incidents, and we actually seek out everyone's experience post-procedure. We have a satisfaction survey that we share with the patient. So we want to know everything that happens, whether it's a good experience or a bad experience. We see that as an opportunity to improve things. And whenever we have had a situation like that, we do look at it as a way to improve it for the next patient. We do everything we can to make things right with the patient who was, upset or did not have a great experience. But certainly we understand how that can impact the next patient too.
Definitely. Well, awesome. I guess my last question is just any piece of advice that you have for anybody working in this department, this area of, trying to make sure the client is having anybody along the line pretty much. What is your one piece of advice you would give them to give the client a comfortable experience?
Yeah, it's the same thing I've said already a couple of times, is remembering that that's a person there who may be apprehensive or anxious about having their procedure done. And so put yourself in their shoes and make sure that you are treating them as you would like to be treated.
Definitely. Well, thank you so much. I really appreciate you talking today. It was very insightful, and I think a lot of people definitely could learn from this piece of advice. I mean, I really liked when you did say you're treating the patient, you're not treating the issue here. It's all about them. It's all about their experience. So thank you so much. I really appreciate you talking to us.
Thank you.
I'm Hailey Hough, and I look forward to seeing you on the next episode of FAQ.